The state health department is standing up vaccine clinics for monkeypox. The strategy is very different than COVID, though some hurdles are the same. Our Anusha Roy wondered why we're running into the same issues after all the practice from the pandemic.
Of all the times we've talked to Dr. Michelle Barron over the last few years, it's rare we hear this.
For most people, this is probably not something that they need to be worried about.
Today, we're talking about monkeypox, the virus behind the new state vaccine clinics, an awareness campaign to watch for symptoms, including rash.
Monkeypox is different than COVID. It's not as contagious. The primary way that it's spread is through direct skin-to-skin contact. So unlike COVID, where we had a lot of people, really the whole community was potentially at risk as we started seeing cases and community spread ramp up. Right now for monkeypox, we have, right now just a kind of a defined population that we're working with that are at risk. And that's men who are gay, bisexual, or men who have sex with other men, especially if they had anonymous partners or multiple partners in the past 14 days.
This is who the state is hoping to reach with a very limited vaccine supply. Last week, the vaccine sign-up filled up fast with more than 80 people waiting. More demand than supply feels like the early days of the COVID vaccine rollout. So why is that happening again?
Monkeypox vaccination isn't available commercially. We are really limited to getting that through the federal strategic national stockpile.
Pair that with where health officials know the virus is spreading right now.
Primarily because there have been outbreaks in other parts of the world that were affecting that population, and the initial cases from the US had traveled to those areas. It's really just the social network that it's spreading in at this point, and our efforts are on par to try to control that spread so it doesn't result in wider community spread.
That last point is important.
Anyone is potentially susceptible to monkeypox.
Even knowing that, the state said there is a reason they are so focused on a smaller population.
We really are taking a data-driven approach to get the limited amount of vaccine to the individuals who will benefit most.
Not on the same magnitude as COVID or flu or a lot of the other things. Now that could change, obviously.
So the version in the U.S., including the 8 cases in Colorado, don't seem to be making people severely sick. There are other variants in other countries, though. Once again, state is waiting on the feds for more vaccines, potentially in the next couple of weeks, with promises to scale up quickly. The state is gearing up in case that this does go into a bigger outbreak. And one of those big COVID lessons, Kyle, is they now know what kind of public health workforce they need to scale up quickly. They know what kind of workforce they need for contact tracing. They've got the infrastructure to expand vaccines if that's what is needed. And then a huge part is communicating to the public properly about what's going on.
Yeah, I remember one of the initial hurdles with COVID, Anusha, was the fact that our testing scheme was dog excrement at the beginning. And so we couldn't coordinate a response because we didn't have a good baseline of testing. And it's not like you hear about a ton of people in the community getting tested for monkeypox right now.
Yeah, no, I had this flashback to, 2 years ago, everybody was so confused about where do you go. This time is interesting, right? The state is testing. LabCorp today announced that they're testing for monkeypox. But Dr. Barron said you can actually already just test in the doctor's office. It's possible with just those commonly found supplies. The issue is people need to watch out for the symptoms. They need to know about it. But so do the doctors, actually. And so UC Health has now reached out to all of their emergency departments, all of their urgent cares, all of their doctor's offices saying, here are the symptoms. Here's what the rash looks like. If you think someone has it, call us. We'll walk you through how to test it. So it's very different landscape with that.
Yes, those docs who treat high-risk patients know what to look for. All right, Anusha, thank you.